Hi, my name is Kyle McCormick. I am in EXS 486 on Thursdays at 12:30, and my presentation topic is going to be on hyperthyroidism. The reason I chose this topic is because family members of mine have had this before, so I wanted to delve a little bit deeper into the research and get a better understanding of it, and then be able to present this topic to you. Some other common names for hypothyroidism would be Graves' disease, Basedow's disease, which is a name off of someone who has discovered it, uh, diffuse toxic goiter, and then thyrotoxicosis. But what exactly is hyperthyroidism? Well, when your thyroid gland begins to create too much of the T3 and T4 hormones, it can cause a spike in your metabolic rate. And due to the spike in the metabolic rate, you can experience severe weight loss, irregular heartbeats, and then the rest of your body system's just speeding up due to these hormones being secreted at an alarming rate. What exactly are T3 and T4 though? So as I said earlier, both cause the rate of someone's metabolism to rapidly increase or decrease depending on if you have hyper or hypothyroidism. They are made by combining the element iodine along with the amino acid tyrosine. Now, T4 is called thyroxine, and it is made in the thyroid gland, but it is the inactive form of the thyroid hormone itself. So T3, though, is called triiodothyronine, and it is converted from T4 into T3 because T3 itself is the active form of the hormone. You can look at the bottom and see some differences in the makeup of it, um, based from allmedicalstuff.com, just showing a breakdown of how these two hormones are created and formed. So, what are some common symptoms for people with hyperthyroidism? Well, one of the most common symptoms is rapid weight loss because of the increased metabolism. Due to that, a lot of patients or clients who have this disease are recommended to stop exercise immediately or stop their sport immediately because they do not want to put the excess tax on the body because their metabolic rate can just not keep up as it is. The thyroid gland can swell up and make the neck look larger than normal. Um, this is what happened to actually a family member of mine. Due to the body's increase in energy consumption, it does start to feel fatigue and muscle weakness throughout the entire body. Mood swings, which can occur, which can be a result from the fatigue itself. Most people who do feel fatigue do experience some form of mood swings. It just happens to the average population as well. So adding that on will obviously enhance that. But how exactly is someone diagnosed with hyperthyroidism? Well, everyone can go on WebMD and self-diagnose themselves, but that's not exactly what doctors do. So, what are some tests they run? There are external symptoms, like discussed earlier, where necks can swell up, or people might feel fatigue. But that doesn't always mean hyperthyroidism itself. It could just be a number of other things. However, what they will do is doctors will run blood tests to see the traces of T3 and T4 hormones in the blood. And depending on how the levels appear, they can diagnose you with either hyper or hypothyroidism. In this case, your T3 and T4 levels would be elevated significantly, so they would diagnose you with hyperthyroidism. But how exactly do you manage hyperthyroidism? Well, there's multiple options. For starters, there's the radioactive iodine, which is taken orally, and it can get absorbed by the thyroid gland after being broken down. And what it'll do is it'll actually cause the thyroid gland to shrink down in size. And because of the shrink in size, it will actually slow down the productivity of the hormones T3 and T4 creation. There's also some anti-thyroid medication, which over time can gradually slow down the production of the thyroid gland. This is what the family member of mine took. For some people, this does clear the problem permanently, but some others may experience relapse, so it's important for continual doctor visits and making sure that the levels do not spike back up and that they stay natural for at least a couple months after they've gotten back down to normal. Beta blockers are another option. However, they don't directly cure hypothyroidism. They may ease some of the symptoms, but they're not going to exactly cure it. For example, it might slow down the heart rate, which can be accelerated due to hyperthyroidism, but that doesn't mean it's actually going to cure the problem itself. Surgery is an option. However, it is seen as one of the last options. It should really only be used if the oral drugs cannot be tolerated. For example, if someone might be pregnant, you don't really want to ingest something foreign for the fetus to take into itself, so surgery would probably be the best option in that circumstance. However, in all others, oral is probably the best option. So, what do they say about exercising and hyperthyroidism? Well, it is recommended that patients who do have hyperthyroidism stop exercising immediately. They do not want to continually put that stress on their body externally if it's going to be continually put on internally. Doctors will tell patients that they need to stop whatever sport they're doing until they can get their levels under control. But however, once levels are within the normal range, exercise prescription following an exercise test should be implemented intermittently, all while a specialist should be looking over their shoulder and monitoring them at every step of the way. So let's take a look at this one quick case study. So Mr. T, he's an 18-year-old student who is currently a football player at his local high school. He was diagnosed with hyperthyroidism at the end of last year and was hoping to get back to practicing with his teammates come this fall. His blood test was done about a month ago, showing signs of T3 and T4 lowering, but they were still slightly elevated. At rest, his heart rate has become regular and his weight loss has slowed down drastically. Patient has slight fatigue but claims he feels fine and is ready to get back to exercise. Now, it's important to ask what medications he's taking, if he is taking any beta blockers, because that could be the reason for his heart rate dropping. However, if the other tests came back and his T3 and T4 levels are being lowered, and they're back to normal, it is okay to start an exercise test and exercise prescriptions. Probably the best exercise test to give someone with hyperthyroidism would probably be the Bruce Protocol test. It should be monitored, obviously, as all exercise tests are. However, it's extremely important to make sure that this doesn't obviously cause the respike in T3, T4. So they should be hooked up to the EKG while doing the protocol, and they should be monitored for any irregularity in the heart rate. And also, not only that, but asking the patient how they feel using externally with RPE scale, and just seeing if everything that they say and everything that's being reported matches up with what might be normal for someone in their age range and body stature. For example, if he has a previous history of exercising and he's already tapping out at the second stage of a Bruce protocol, that might raise some awareness. You might want to look deeper into that. But barring everything turns out okay, it should be noted that you should start an exercise prescription with this individual. The prescription should be monitored, though. You shouldn't just send them back as is. You should gradually bring them back into the fold. Obviously, and it is recommended that any exercise prescription should be implemented in multiple stages. So stage 1 would be where an individual can perform light activities, for example, walking or cycling for about 30 to 60 minutes a day for 3 to 5 weeks. As with anything else, these can be broken into 10-minute bouts. It doesn't have to be 30 to 60 minutes straight. But at the end of the day, they want to get at least that much exercise per day throughout the week. After about a month, though, the client may progress to stage 2, where in this stage, resistance training can be incorporated about 3 times per week, as well as the increasing the aerobic activity to about 5 or 6 times per week, while also increasing intensity. Again, after about another month of this, stage 3 would be the final stage where the client can increase to more vigorous activities, as well as upping the amount of times performing resistance training along with endurance training. While these are good guidelines to follow, though, each patient should also be taken as an individual, and some alterations may be needed depending on what that individual client needs. So if the client isn't obviously progressing well within the first 3 to 5 weeks, they might need a little longer in stage 1. Or some patients may respond very well to external stimuli and may progress more rapidly. It should all be taken on a case-to-case basis. In conclusion, so hyperthyroidism may not be as common as some other serious diseases like hypertension or diabetes or acute coronary syndrome or anything of that nature. But that doesn't mean it should be taken as seriously, because if left unchecked, it can cause some severe problems down the road. It's not always the most looked at thing for everyone. Exercise testing and prescribing is important for all populations. However, the extra level of precaution should be there and should be taken for someone with an overactive thyroid, because you do not want them to overexert themselves and put more excess stimulus on the body that is not needed or warranted. However, once all levels balance out, it is important to begin a monitored, I emphasize monitored exercise program, because most patients probably wouldn't know what it feels like to have an overactive thyroid. So uh, keeping them following along the right program and making sure they're moving at the right pace and everything is in a controlled environment is obviously best and should be highly recommended. Only after they completed all the prescription in a monitored setting, they can be returned to play for whatever sport they are at. However, even at that, though, they should still come back for continuous visits to make sure that everything stays as normal and does not respike back up. Um, and then at the end, attached are all of my references. I've taken multiple. So thank you for listening to this discussion. I hope you have learned a good deal about hyperthyroidism, and I hope it has brought you some awareness.